After having successfully published the quarterly centennial anniversary issue in 2023, which was devoted to the broad theme of the future of population health, we wanted our next special issue to focus more narrowly on a theme of great importance to state health policymakers. So we asked Morgan McDonald, the Fund's National Director for Population Health and Health Equity Leadership, to help us identify an appropriate theme by querying members of the Milbank State Leadership Network regarding the issues that are most top of mind. It was clear from those inquiries that the dual and overlapping problems of mental health and substance use were among the most troubling concerns for policymakers. Based on this feedback, we decided that the special issue should be devoted to the theme of mental health and substance use challenges facing the United States, with particular emphasis on what state policymakers could do to address the problems.
More than 1 in 5 adults and 1 in 5 adolescents live with a mental illness. And of people who have a mental disorder, about half don't receive the care that they need to manage the mental disorder. So that's a huge public health concern for the United States right now. At the same time, more than 80,000 people die each year from a drug overdose. And of people who have a substance use disorder that places them at risk for an overdose, only about 23% receive care. And in particular, states have the potential to do a lot to address these issues by passing laws and enacting policies. Some of the types of policies and laws that can help address these problems include, for example, laws that regulate products such as guns, alcohol, tobacco, and cannabis, laws that expand access to treatment for substance use disorders and for mental illness, for example, through Medicaid coverage, as well as at a broader level, funding and investment in for prevention, treatment, and services to reduce harm from drug use and mental health. As well as at a much broader level, I think there's real value in investment in policies that address the vital economic and social needs of the population.
We found that a number of economic and social support policies are really important for mental health, often because they influence people's economic well-being, their risk of poverty, their sense of economic security. We've also found that these policies tend to really cluster along state lines. So states that have implemented an increase in their minimum wage, or they've implemented paid sick leave, or they've increased the generosity of their unemployment insurance. These policies tend to all cluster together, whereas states that haven't implemented one of these often don't have any of these on the books. Another important thing that came up while we were working on this study was the fact that a lot of these economic and social support policies, they have bipartisan support among voters. So for example, the states that most recently implemented paid sick leave, for example, are all typically conservative states. So states like Missouri and Alaska, for example. And Missouri is also a state that's implemented a wide range of these social and economic support policies because they're popular among voters. And one way this has happened has been through ballot initiatives. And it's important to keep this in mind in the current context when we're seeing a lot of talk about slashing funding for a lot of these policies that are particularly important for health and well-being. So, housing policy isn't just housing policy, it's also mental and physical health policy. Anti-poverty policies are also health policies.